Welcome to another edition of Lasing is Amazing. Today we're going to look at hyperplasia and an I-plus gingivectomy from a calcium channel blocker induced hyperplasia. This is a 65-year-old male. You can see here with extensive hyperplasia in the lower anterior. We're using an MZ6, actually an H mode in the beginning. You see it's quite inflamed. We're using it 2 watts, 40 hertz, 10% water and 12% air. When you're using H mode, sometimes because the laser wavelength itself is not well absorbed in air, you'll find that or in water, you'll find that you get a little bit of bleeding. You can see here we're removing the tissue, and you can see that there's a little bit of bleeding in this particular portion of the procedure. So we decided after we removed the mesial papilla of the canine to up the setting slightly for the adjacent papilla and to use S mode. Same settings, but S mode. Typically when you use S mode, you want to raise the settings a little bit because the tissue will tend to accumulate to the tip of the laser. The S mode works because it's a longer pulse, and you'll find that there's less bleeding involved when the tissue is vascular. After you remove both papillas and do your gingivectomy, you have to debulk the actual facial aspect of the papilla. And you'll see that at this point, we're now going in and we're going to go and remove the facial aspect of it, to thin it down. This is easier to do, much easier to do with a I-plus or erbium laser, where you can shave the tissue compared to a diode where you have to sort of brush it, and it really doesn't work as well for fine-tuning your papillas. It works much better with the I-plus. And again, used in S mode, not so much bleeding. It's still more than what we would like to see. Now you can see we've completed the adjacent 3 incisors. We're now looking at the lower left lateral incisor and going to do the gingivectomy on this enlarged papilla there. You can see now, again, using S mode, a slightly higher setting of about 3 watts of power, you can see that we're cutting much nicer and not having as much tissue stick to the tip. You can decrease the amount of tissue sticking to the tip by increasing your water and stopping it periodically to have your assistant remove the tissue from the tip itself. And this happens more likely in S mode, where the pulse duration is longer and you get less bleeding. You can see here the papilla has been removed, and now at this point we're going back to the first papilla. We're going to use our EPIC diode 940 nanometer wavelength at 1.0 watts with an initiated tip to try to get some coagulation. You can see here with the brush strokes, we're able to get the area to stop bleeding and to have a significant improvement afterwards in the oozing that was happening from the I-plus. So again, it's helpful at times to have 2 wavelengths to be able to offer you potential solutions. Here's immediate post-operative results. You can see a significant improvement over where we started. And 2 weeks later, you can see that although healing is not complete, there's a significant improvement. At this time, we'll take the laser in uninitiated format, both from the outside, try and have some biostimulation through low-level laser therapy, and also in the inside of the soft tissue to see if we can help with that. And again, this case is proceeding on, but you can see the 2-week healing is a significant improvement over where we started. I want to thank you for watching today's version of Lasing is Amazing, and thank BioLize for their constant support and their global leadership in laser technology.